Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi, everybody. Tom Viola with Pharmacology Declassified. We get another Fast Facts Pharmacology Edition. Well, this episode is going to be about estrogens. Estrogens, as we know, are used as medications, but they're also a naturally occurring female hormone. We use estrogen as a drug to supplement your production of endogenous estrogen. Why? Why would we want to give you estrogen? Well, first off, because maybe you have dysmenorrhea, okay? So we use estrogens to treat certain types of menstrual issues. Second, you might have issues with menopausal symptoms, okay? Night sweats and hot flashes. And sometimes estrogens are very effective in helping you overcome those symptoms as well. Third, we might use estrogen to treat osteoporosis. You know, when you think about it, for most women, the greatest bone density they have is during their life when they're not menopausal. Once they become menopausal and the estrogen in their body wanes, that's when their osteoporosis risk begins, because estrogen as a hormone keeps your bones dense. And for women, that's a decided advantage because men don't have estrogen, obviously, and therefore for us to have bone density, we need to carry around more mass, usually more muscle mass, because muscles are attached to bones, right? But women with estrogen can have dense bone without having to carry around all that extra mass, and therefore don't put as much stress on their heart. So that does have one advantage right there. But again, when the estrogen starts to wane during menopause, osteoporosis can happen rather quickly. The last reason we might use estrogen would be for contraception. We use it in very low doses to fool your body, if you will, into thinking it's pregnant so you won't ovulate. So that's why we use estrogens, and obviously we like the drug because they do good things for us, but they do have some nasty side effects, like what? GI upset, edema, and weight gain, which can lead to hypertension. And don't forget, whenever we give estrogen as a drug, there's always a risk of two things: an increased risk of cancer, breast cancer, uterine cancer, as well as an increased risk of thromboembolism. So we're always concerned about using estrogens for longer than we have to. If we're going to use them as contraceptives, we use them in very low doses. If we're going to use them to treat menopausal symptoms or menstrual issues, we try to use the lowest dose possible, lowest effective dose, because we're very aware of the risk of cancer and embolism. Of course, the question that always comes up is, do antibiotics or antibacterials that we use in dentistry make oral contraceptives less effective? The answer is Ness, as in we don't know, okay? But we tend to err on the side of conservative and say perhaps. So that's why we always tell our patients, if they're using oral contraceptives, to use an alternate form of contraception if they're going to be using an antibacterial. But otherwise, estrogens are rather safe drugs. Remember, there's estrogen replacement therapy and there's hormone replacement therapy. In this case, we're talking about hormone replacement therapy. Estrogen replacement therapy is a different type of estrogen dosing, which is more commonly used in the management of osteoporosis. And that'll be one of our next topics coming up in our next Pharmacology Fast Facts. Until then, my friends, this is Tom Viola. Be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products, from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.